Welcome everyone who's here, and thank you for joining us today for our second session of the HCA Opportunities for IENs, which is with Health Match BC and the Choose to Care team. We are very excited to have you attend one of our team's first virtual event of this size. We hope that you're able to get information you're looking for today and have an opportunity to ask your questions. I would like to acknowledge that I am very fortunate to be able to work, live, and play in this province, comprised of the many traditional, ancestral, and unceded territories of First Nations, Métis, and Inuit peoples. So I'm just going to start by giving you an overview of today's event. So first, you'll hear from myself and the Choose to Care team. We will give you an introduction of who we are and what supports we provide internationally educated nurses, which we will call IENs during this presentation because it can be a long word to say. We will then walk you through the HCA registration journey for IENs in BC. And a unique aspect of today's webinar that we're really excited about is that you will have an opportunity to meet with our provincial health authorities to hear about HCA and other job opportunities, as well as other key players in the system, including BC Carried Registry, the Nursing Community Assessment Service, which we will refer to as NCAS, Career Paths for Skilled Immigrants, and our very own nursing team to speak about the pathway to becoming a licensed nurse in BC. We will do a roundtable so that you can get a brief overview of each organization before we open the breakout rooms, allowing you to visit them individually. And once we've heard from our guests during the roundtable, our technical support team will open up the breakout rooms and you'll be able to join them. So we will provide further instructions about this later in the presentation. So our Choose to Care team is a program under Health Match BC, which is a division of Health Employers Association of BC. The program launched in 2019 through partnership with the provincial government, employers, educators, and industry associations. The purpose of our team and the program is to increase public awareness of the healthcare assistant profession and to provide potential HCAs with the information they need to train, register, and become employed in BC. We are funded by the BC government, specifically by the Ministry of Health. I did include a link to our website here because I encourage all of you to check it out if you haven't already. We recently revamped the website and with updated content and enhancements to user experience. And it is a very great resource for you or anyone else interested in joining the HCA workforce in British Columbia. There are also custom landing pages on the website with information to support specific groups, and there is one for internationally educated healthcare professionals. Now meet our team. So we started as a team of 2 back in 2019, and now we're a team of 4 and growing. So I am Andréane, and I'm the lead for the HCA portfolio and the Choose to Care team. I am joined today by Charlotte and Megan. Charlotte and I will be in the breakout room portion of the event for representing the Choose to Care team, if you have more questions for us. And then Megan will be available in the main room to help you with any technical difficulties. Who is Health Match BC? So Health Match BC is a free recruitment service for health professionals funded by the government of British Columbia. Our teams have been working with BC health authorities for over 20 years. Health Match BC is made up of the Nursing and Allied Health team, the Physician Recruitment team, and the Healthcare Assistant team, which is us. We have representatives from our nursing team, like I said before, and we encourage you to visit them in their breakout room if you're interested in learning more about the pathway to becoming a licensed nurse, which seems like lots of you are looking for information on that. Please note that Health Match BC acts in an advisory capacity only. We do not make any decisions regarding employment or immigration. Our teams are here to provide information and guide you through the pathway of your choice. I also wanted to include this map to show you the different geographical areas that our provincial health authorities who are here today cover. So if you are interested in working or moving to a particular area of BC, you may want to speak with that health authority in the breakout rooms. I would like to go through the HCA registration pathway for IENs. So here's a process map. It may look a little bit overwhelming, but hopefully once we go through it, it will feel a little bit less overwhelming. So we tried to include the approximate timelines as well as costs that you can expect. So if we start here where it says start, the first step is to submit an online application to the BC Care Aid Registry. If you qualify, you will be referred to the Nursing Community Assessment Service, which is NCAS. And then you will be contacted by NCAS at this point, as we can see in number 4. And then you will be asked to book and pay for the NCAS assessments, which includes the computer-based assessment and the simulation lab assessment, which is delivered at Langara College in Vancouver. The total for both assessments currently is $2,100 after tax. If there are some competencies that were undemonstrated during the assessment, so once you've taken the assessment, you'll get a report and the registry will get a copy of your report. So if there's any competencies that were undemonstrated, you will be referred to additional education by the registry. And this can really range from a few online modules to a full HCA program. So the costs here vary. And then once you complete the courses, you will receive your registry number. If there's no competencies that were undemonstrated, you will get your registry number right away. And with that registry number, you will be eligible to work in any of the publicly funded settings. So any of the health authorities here have a requirement for HCAs to have their registry number. And more employers outside of the health authorities are requiring this now. Because it basically, what the registry is showing by having a registry number, you're showing that you have the basic competencies to practice as a healthcare assistant in British Columbia. So just wanted to layer on top the Choose to Care bursary supports that can help you financially as well as guide you through the process. So if you're referred to complete NCAS by the registry, you are offered an opportunity to connect with our team, the HCA team at Health Match BC, to discuss your eligibility for financial support. So our team offers one-on-one support and guidance through this process, as we know that each person's situation is quite unique. If you are eligible to receive funding, we will sign a bursary agreement that confirms that you will receive the NCAS bursary of $2,000 once you've completed the assessments. We also have a rural allowance for those needing to travel from outside the Lower Mainland to complete NCAS. That rural allowance ranges from $750 to $1,000, and it's based on the distance between your primary residence and the NCAS simulation lab assessment site at Langara College in Vancouver. If you're referred to transitional education, we will guide you through the process and support you financially with the remedial education bursary, which ranges from $150 and $1,500. So for anyone referred to a course with a mandatory in-person component and live far away from that institution, we now have a rural travel allowance in addition to help you with extra expenses. So if you would like more information about our bursary program and how to access it, come visit Charlotte and I in the Choose to Care breakout room. We will also be providing copies of these process maps in a follow-up email after the webinar.
Yeah, absolutely, Andrea. All right, we will now move on to our roundtable, where each guest speaker will give you an overview of their organization. You will have a chance to speak with them directly in the breakout rooms. So for now, hold your questions, and our guest speakers, are just going to present their organization to you. We will start with the BC Care Aid Registry.
Thanks, Charlotte. Hi, everyone. My name is Serena Corsi. I'm the program manager at the BC Care Aid and Community Health Worker Registry. And today, I'm looking forward to speaking with you in the breakout session. The registry, as you may know, is the oversight body for care aides and community health workers in British Columbia, also known as healthcare assistants. And it was established in 2010 by the Ministry of Health. Some of the key activities of the registry to meet our mandate are that we register healthcare assistants and provide a database where employers can verify registration prior to hiring. We also follow up when an employer reports alleged abuse of a client by a healthcare assistant. We review and recognize HCA education programs, and we also share information about resources and continuing education opportunities for healthcare assistants. And today in my breakout session with you, be focusing on internationally educated nurses' pathway to registration. And as IENs discover, when they come to BC, you need to be registered if you wish to work as an HCA for a publicly funded healthcare employer. And I'll be speaking to you about trends, some very positive ones, including a 64% increase in registrations of IENs or IEH international applicants in 2021. And we'll also be looking at how we can make next steps to moving forward in the process more accessible and achievable. The actual time commitment to do the assessment is very minimal, but it does, and there is funding available. So we'll be speaking to you about just how to approach the process. So look forward to speaking with you today in the breakout room.
Thank you, Serena. All right, we're going to move on to our next guest speaker, which is the Nursing Community Assessment Service, otherwise known as NCAS.
Good afternoon, everybody. My name is Ariella. I'm the Manager of Program Operations at NCAS, or the Nursing Community Assessment Service. NCAS is the provincial competency assessment program for British Columbia, and many of you will be or already have been referred to NCAS on your pathway to registration. Our program is designed to assess your professional skills against entry-level competencies. So we're looking really to compare against what we might see with a recent Canadian graduate. Through our assessment, we're then able to provide the BC Care Aid Registry or the BC College of Nurses and Midwives, depending on the profession you're being assessed in, with more information to aid in the registration decision-making process. So we assess 4 different professions. They are here listed on the slide. We see healthcare assistants, licensed practical nurses, registered nurses, and registered psychiatric nurses. We also offer a dual track option for RNs. So this is a great way to be assessed for 2 professions at once, for RN and LPN at the same time, which may help you enter the workforce faster and save you time and money in the registration process. We're also very excited to be launching a triple track assessment program in May of 2022, which will allow eligible candidates to be assessed for RN, LPN, and HCA simultaneously with 1 single assessment and 1 fee. More information will be available on this program on our website in the coming weeks. In the breakout sessions today, though, what I'll be offering is an overview of what the NCAS assessment is, how it works, what to expect during the assessment process, and how you can prepare. Of course, I'm also happy to field any questions. I look forward to seeing you in the breakout sessions.
Thank you, Ariella. All right, we're gonna move on to the next guest speaker. It's actually our own Health Match BC nursing team. Take it away.
Thanks, Charlotte. Hi, everyone. My name is Shadi Didavar, and I am part of the Nursing and Allied Health Recruitment team at Health Match BC. As Andreanne mentioned, Health Match BC is a free recruitment service for health professionals funded by the Government of British Columbia. We've been working with the BC Health Authorities for over 20 years to facilitate recruitment at 200 facilities across the province. Our primary role is to attract registered nurses, registered psychiatric nurses, nurse practitioners, and certain allied health professionals to the many wonderful employment and lifestyle opportunities available in the public sector in BC. We use connectivity, collaboration, and communication to ensure that we fully understand the people and needs on both sides of the recruitment process. We recognize that the journey may look different for each of you, so we relate to everyone as individuals. We are here to answer questions, connect you to the people you need to be connected with, and provide encouragement to help you find the right role in the right location. We are also here to help you navigate the credentialing and licensing process to become a registered nurse or registered psychiatric nurse in BC. We don't make any decisions regarding employment, immigration, licensing, or credentialing, and act in an advisory capacity only. But think of Health Match BC more like a compass. We don't build the path and we can't walk the path for you, but we are here to guide you and help you navigate along the path so that you get to where you want to be. If you are interested in hearing more about how we can help you and about how to obtain a nursing license, please make sure to visit us in our breakout room. Thanks.
That's great, Shadi. Thank you. All right, moving on to career paths for skilled immigrants.
Thanks, Charlotte. Hi, I'm Claire. I'm one of the career coaches at the Career Paths for Skilled Immigrants program. At Douglas College, the health stream of the Career Paths program is a free government-funded program to assist internationally educated health professionals to gain registration to practice and to work in the same occupation that you were working in before coming to Canada. We provide one-to-one coaching, healthcare specific and professional communication skills workshops. We help with finding healthcare employment and financial supports. We're working with about 300 international nurses in the program at any time, which enables us to become real experts on helping you overcome the challenges you're facing and to develop specialized services and supports to help you become more successful in your pathway. So this isn't an academic program to teach you to be a nurse or a care aide. It's an employment program to help you leverage your existing education, skills, experience, and gain your license to practice in your field of expertise. And then also to help you find related healthcare employment in the meantime. We're working with many IENs who are looking to gain either or both of their nursing or care aide registration. You heard earlier from Andréane about the bursaries that are available through Choose to Care. It is possible to access both the bursary program and the supports from Career Paths at the same time. So if you're interested to learn more about the program and the eligibility and how you can apply to the program, come and join us in our breakout room. Thank you.
Absolutely. Thank you, Claire. All right, Fraser Health, you're up.
Ava, your speaker. Oh, there we go.
Did this the last time too, and it happened again. I'm so sorry. Thank you, Gamal. Hi, everyone. I'd like to introduce myself. My name is Ava Charogi, and I'm joined here by Gamal, and we both represent Fraser Health. We are representatives of the talent acquisition team. Just want to give you a brief summary of our organization. So a couple of highlights about Fraser Health. Fraser Health is one of Canada's largest and fastest growing health authority in British Columbia. We have over 29,000 employees, 2,500 physicians, and nearly 6,500 volunteers as part of our organization. We also have 12 acute care sites from large to small, including Surrey Memorial Hospital, Royal Columbian Hospital, and Abbotsford Regional Hospital. Besides hospital care, Fraser Health has a community-based residential and home health, mental health, public health, and primary care services available to our community. For most of you familiar with British Columbia, geographically, we cover areas running east to west from Burnaby to Hope and north to south from the Canada-US border all the way to Boston Bar. We comprise of 1/3 of the total provincial population and offer a wide range of integrated healthcare services to more than 1.9 million people and growing. We look forward to connecting with you in the breakout rooms.
Thank you, Ava. That was great. Yeah, interior health.
Great, thank you. Sorry, 1 second. So Interior Health is the publicly funded healthcare provider in the southern interior area of British Columbia. When most people think about healthcare, the first thing they think about are the hospitals that we operate. While many of our services are offered in the hospitals, we do operate a wide variety of other important services, including prevention and health promotion, home and community care, long-term care, mental health and substance use, environmental safety and public health protection, lab and diagnostic imaging services, support services, administrative tasks, and so much more. Interior Health encompasses a very large and geographically diverse area covering 215,000 square kilometers. The region covers a cross-section that includes some of the more rural and remote areas of the province, and also some of the fastest growing urban centers such as Kelowna and Kamloops. We have included a map in our breakout room to show our 4 main regions, which we will talk about more, and look forward to touching base with everyone there. Thank you.
Great. Thank you, Rob. All right, moving over to Island Health, Vancouver Island Health.
Hi, everyone. My name is Crystal, and I also have Nicole here with me today, and we're speaking to you on behalf of Island Health. Island Health is a health authority that looks after Vancouver Island and the surrounding Gulf and Discovery Islands. So we're right off the coast of BC over here. So there's 4 main points I want to talk about today. Number 1 being that Vancouver Island has the most temperate climate here in Canada. So what that means is we don't have that typical Canadian kind of crazy weather. We don't have a crazy hot summer. We're kind of somewhere in between. So this leads into my next point. We have lots of sports and recreational activities that you can do all year round. So if you want to go ski in the morning in the winter and come down and play golf in the afternoon, you can do that here. There's lots of availability for different sports and recreational activities all across the island. We also offer a variety of positions available that are for internationally trained nurses while you're studying. So do you want to work as a healthcare aide in maybe acute care, long-term care, you name it? We have these opportunities available for you. They can be casual or on a temporary basis. We also have lots of employer-paid specialty education opportunities for nurses. So maybe this is something that you're thinking about down the road and you're looking into maybe working in critical care, emergency, perinatal, you name it. We have those opportunities available that are funded through Island Health. So we're ready when you're ready. We'd love to connect with you and talk a little bit more about Island Health and what your interests are. So once the session is over here, we'd love to speak with you in our breakout room. Thanks so much for having us here today.
Thank you, Crystal. All right, now we welcome Northern Health.
Hello, everyone. My name is Keenan. Different than Dean's contact information that's on the slide there. Unfortunately, he was unable to make it this afternoon, but I'm happy to speak to all of you on his behalf with respect to Northern Health. So for those who don't know, Northern Health covers about the top 2/3 of the province of BC. So spanning from about Quesnel and Valemont north to the Yukon border, and from the Alberta border all the way to the Pacific Ocean, including the beautiful islands of Haida Gwaii. So we have around 7,500 employees spread between 25 acute care facilities, around 22 health units, and 16 long-term care facilities. And through those sites, we serve a population of over 300,000 people, in addition to 54 different First Nations communities. So while we are the largest of the geographic health authorities in terms of area, we are the smallest in terms of the population we serve and the amount of employees that we employ. So if you're interested in learning more about Northern Health in general, our current career opportunities, or the communities we serve, feel free to join me in our breakout room, and I'd be happy to give you some more information.
Thank you, Keenan. That was Northern Health. Right, moving on to Providence Healthcare.
Hi, good afternoon, everyone. I'm Manisha Gill. I'm one of the recruitment advisors here at Providence Healthcare. We're a Catholic-based health organization with a focus on treating those that we serve and each other with compassion and respect. We're also committed to truth and reconciliation by delivering culturally safe and appropriate care and improving health and wellness for the Indigenous peoples in BC. We're an organization that truly lives its values, and we're based out of downtown Vancouver. We have about 6,000 employees and growing, and our sites include St. Paul's Hospital, which we are currently building a new site with an expected completion in 2027. We operate Mount St. Joseph Hospital, as well as 5 long-term care sites. In 2021, Providence Healthcare was named a BC Top Employer, Canada's Best Diversity Employer, and Top Employer for Young People. We offer comprehensive wage and benefits, staff discounts, research opportunities, specialty training opportunities, and an effective nurse to educator ratio for support on the unit, as well as opportunities for leadership roles and comprehensive leadership training. So if you're interested, please join me in the breakout room to learn more about our organization. Thank you.
Thank you, Manisha. All right, moving on to our last guest speaker, last but not least, Vancouver Coastal Health.
Hi, everyone. My name is Jessica Atwell. I am one of the recruitment advisors with Vancouver Coastal Health, and I'm also joined today by my colleague, Mandy Dio. So Vancouver Coastal Health is one of the 5th largest health authorities providing services to BC residents. Our team consists of over 20,000 staff and volunteers, and we deliver services to more than 1 million BC residents. The communities that we cover, we provide services to are Richmond, Vancouver, North Shore, Sunshine Coast, Sea to Sky Corridor, which includes Squamish, Whistler, and Pemberton, Powell River, Bella Bella, and Bella Coola. So I would like to cover that the huge territory that we cover. We have a lifestyle that fits whatever your style is or wherever you'd like to work. So we do cover a large territory, whether you want to live in a rural community or an urban community, we have something for everyone. The services that we provide vastly vary through primary care, community-based long-term and home health care, mental health and substance use services, public health, hospital care, and research. So whatever area you are looking for a job in, we have that available, and we are more than happy to help you find the job that fits your career goals. Later on in the breakout rooms, we'll discuss what community health worker role looks like and how you can get into VCH. That may include some training opportunities, the orientations we provide, and also what VCH has to offer as an employer. So we look forward to meeting with you in the breakout rooms. Thank you.